This week we're going to look at neurogenic speech disorders. Neurogenic speech disorders are also called motor speech disorders, and they're problems with the movements involved in producing speech as a result of neurological damage or a neurological disorder. Often there is more than just speech involvement, as in Huntington's chorea, myasthenia gravis, muscular dystrophy, MS. Um, these disorders are chronic and some of them are terminal. Unless there is some sort of concomitant disorder, language is not involved in neurogenic speech disorders. Understanding of language is intact for both reading and listening, and expressive language is intact. However, it will be difficult to understand what the person is saying because voice and speech sounds are impacted. Writing may also be difficult as the disorder that impacts speech may also impact motor control of the hands. We're going to classify neurogenic speech disorders into two groups, dysarthria and apraxia. Dysarthria is a result of paralysis or weakness due to damage either in the central nervous system or the peripheral nervous system. It can affect muscles of respiration, the muscles in the voice box or larynx itself, and the muscles in the mouth and face that are used to shape the speech sounds themselves. Dysarthria is categorized in terms of the site of lesion and its symptoms. And then apraxia is a motor planning issue. It's an impairment of the ability to plan and execute movement. Apraxia can involve any muscle group, and as in dysarthria, unless there is a concomitant disorder, language is not affected. Likely site of lesion for apraxia is Broca's area. Broca's area is thought to be the motor planning area for speech. Let's look at dysarthria types. The first type of dysarthria is flaccid. In flaccid dysarthria, the muscles themselves are weak or they're paralyzed. Damage can be in the cranial or in the spinal nerves, or it can be in the muscles themselves. Weak muscles will tire easily. In flaccid dysarthrias, they can result in shallow breathing, in a breathy voice or a monotone voice. They often result in soft volume because of the lack of breath support. And you'll have imprecise speech sounds that result in speech sounding slushy or slurred. Causes of flaccid dysarthria include myasthenia gravis, muscular dystrophy, and bulbar palsy. The second type of dysarthria is spastic dysarthria. And like spastic cerebral palsy, spastic dysarthria is characterized by tight, rigid muscles. Lesions are in the lower brain and they're most commonly due to stroke. Speech will be difficult to initiate and it's going to be slow. You may have breaks in pitch and in loudness. And utterance length is going to be shorter, and once again, your speech sounds are going to be imprecise. Ataxic dysarthria is caused by damage to the cerebellum, once again, just like ataxic cerebral palsy. And it's largely a problem of coordination. So what happens is a movement or movement pattern is started, but then the signal that is supposed to stop that movement is never received. So what's going to happen is you're going to have poor coordination of the speech sounds and respiration. You're going to have movements that are going to overshoot their target because the signal inhibiting those movements never is received by the muscles, and the movements are going to be imprecise. Voice will not be powerful because respiration is impacted, and you might not have enough precision in the mouth and facial muscles to accurately produce the sounds of speech. That should not say mouse. The next dysarthria type is hyperkinetic, and these dysarthrias are caused by damage in the mid and lower brain. And in these dysarthrias, there are excessive movements called tics and tremors. Tremors are involuntary rhythmic movements, and tics are rapid, repetitive movements. Common causes of hyperkinetic dysarthria are dystonia, and this is characterized by excessive movements that are prolonged and slow, and they're going to be writhing movements. It can involve the entire body, or it can be limited to a particular muscle group. So in this kind of dysarthria, your speech is going to be characterized by too much variation in pitch and loudness. In other kinds of of dysarthria, such as the flaccid dysarthria, you're going to see monotone speech, but this is the opposite. And you're also going to see a regular breakdown in the production of the speech sounds themselves. So the speech sounds will not sound the way that they are supposed to sound. And then the second cause of this type of dysarthria is chorea. In chorea, the tremors or tics are very fast, and once again, it may involve the entire body or just one set of muscles. Speech is characterized by inappropriate silences, and this is caused by stoppage of the voice. Um, you're going to have breathiness in your voice or a strained voice. Breathing patterns are going to be forced, and once again, you're going to see too much variation in loudness, prolonged pauses, and those imprecise productions of speech sounds. And by imprecise, I mean that the sounds are going to be distorted. The movement pattern isn't necessarily going to hit the place that it's supposed to hit for each speech sound, but it's going to come relatively close. In hypokinetic dysarthria, the lesions are also in the mid and lower brain, but the result is not excessive movement. Instead, you're going to have a decrease in movement as a result of the muscles becoming rigid and stiff. Um, An example of a hypokinetic dysarthria is Parkinson's disease. Um, and speech characteristics in hypokinetic dysarthrias are going to include a harsh, breathy voice, a softer volume, and a slowed speech rate. And in this type, in general, the speech rate is going to be slow, but mixed in with that, you're going to have rushes of speech. So your words are going to come on top of each other very, very quickly, and then you'll have that slow speech once again. And then there's mixed dysarthria. And in mixed dysarthria, characteristics of more than one of the other types of dysarthria are present. Brain damage in these types is generally more global and diffuse. One type of mixed dysarthria is amyotrophic lateral sclerosis, or Lou Gehrig's disease, and another type is multiple sclerosis, or MS. Communication characteristics. The primary characteristic of neurogenic speech disorder is reduced intelligibility. And what I mean by this is a lower ability for a person to be understood using their speech mechanism. Um, so unless there's some kind of concomitant disorder, receptive language will not be impaired, and expressive language will be limited by the individual's motor skills. Let's look at speech in dysarthria versus speech in apraxia. In dysarthria, the individual's speech sound errors are consistent. If they distort their S sound, they will always distort that sound in the same manner. Speech sound errors tend to be distortions rather than substitutions. This means that the individual is coming close to producing the sound they are attempting, but it's not quite there. If there are substitution errors, the substituted sound will be related to the attempted sound. For example, if an individual replaces an S sound with a T sound, that's because these sounds are both produced at the same place in the mouth, and neither one of them uses your voice at all when producing those sounds. So they're related sounds. And then consonant clusters, such as the BL in blue, may be reduced to one component. In this example, blue would be pronounced boo. The B is the easier sound, and generally it's the easier sound that's going to be retained. Treat might be teat or tweet, but those consonant clusters are going to be made easier. Because the speech sound errors are consistent, if you spend enough time with a person, you may be able to get better at understanding what they are saying, because you're going to be able to crack the code, so to speak, of what their errors are. In apraxia, you're going to see groping behaviors with the lips, teeth, and tongue to find the correct position for speech sounds. And the big difference in apraxia and dysarthria is that in apraxia, the errors are not consistent, even for the same word. So, for example, an individual attempting to say the word bat may first say cat and correct it to sat and correct again to tab, and may finally end up by saying bat. So because there's so much inconsistency and so much variability and errors, it's going to be very difficult to understand individuals with apraxia of speech, even for those who are familiar with them and used to listening to them. In consonant clusters, the sound may be added between the consonants. So blue may be pronounced baloo. And then individuals may be able to produce words with no trouble sometimes and struggle to produce the same word at another time. Automatic speech, such as reciting an address, and emotional speech may be completely unaffected. Also, imitation is frequently easier than spontaneous speech for individuals with apraxia. You're not going to see this in individuals with dysarthria. Individuals with dysarthria are in general going to have trouble imitating just as well as they would have trouble with spontaneous speech. We're just going to look at a little bit of this video. This is a young man who has dysarthria, and listen to how he sounds.
Maybe. Everybody, my name is James. I'm an enjoyer of YouTube, speaks beautiful every Friday. This week I'm going to talk about my speech impairment.
He's briefly going
What
to talk
it
about speech impairment. His name's James.
a part of my brain doesn't work
Part of his brain doesn't work.
controls my mouth, and it I can't talk as perfectly.
He can't talk perfectly.
One of the main effects of an impairment is that I would drool a bit.
One of the main effects of the impediment is that he'll drool a bit.
I would always.
So you can hear his speech. His voice is fairly monotone. You can see he's got some poor muscle tone that's resulting in the drooling, and his errors are pretty consistent. And he comes close to producing the speech sounds that he's trying to produce. So while he's very difficult to understand, if you pay close enough attention, you can understand enough of what he's saying to catch his meaning. We're going to look, I couldn't find any adults with apraxia. We're going to look at a little boy, and his mom is prompting him to say some things that his sister has taught him imitatively. His utterances are very short. You'll notice some groping behaviors towards the end of the video, and you'll notice some trouble planning, motor planning some of the sounds toward the end of the video also.
Okay, say hi.
Hi.
What's your name?
Ike.
And what else? What else did you learn how to say? What's that stuff you put into your drink?
Ice.
Ice, yes. And can you say ice, baby?
Ice, baby.
I love it. Okay, wait. Look at mommy. What did sister teach you how to say upstairs?
What?
Say that right to the camera. What? What?
What?
And yeah.
Wow.
Yes, and yeah. Say yeah.
Yeah.
Say it one more time.
Yeah.
And what about you?
Yeah.
No, you start with your smile.
You.
Yes. Yay, give me 5. I love you.
Dada.
So even at that single word level, he has his speech sounds out of order. Communication strategies. Once again, we want to allow time. It is really important to allow extra time. For both dysarthrias and apraxia, the speech rate is generally slower. Be patient and try not to interrupt. And then once again, you want to check and make sure that you understand what your client is saying by repeating back what you think you heard. Use context as much as possible. Try to establish a conversational context. If you know your client is talking about his or her family, you're going to be able to predict what he or she is saying, even if you don't understand every single word. The better you get to know the individual, the more context you'll have, and the better able you will be to predict what it is they're talking about. And in the case of dysarthria, you'll be better able to understand their speech themselves. Stay calm and supportive. People with motor speech disorders are usually aware of their speech difficulties. Often they've lost function that they previously had, and they can get frustrated. However, listening to someone and trying to figure out what they are saying can be frustrating too. We don't want to communicate this frustration to our client. You want to use body language that is open and that's encouraging. You can do this by nodding your head, by leaning forward slightly, maintaining eye contact. All of those things will convey that you are actively listening to your client. You could suggest trying another word or another way to say what they want to communicate. Sometimes your client can get hung up trying to produce the word they're trying to say. They just want to get that word out. And another word might be easier for them to say and still get their meaning across. So if they're really struggling, you could suggest very politely, is there another way that you can tell me? You could say, our next strategy, use visual cues. You could say, is there a way that you could show me? Could you point to something? Could you use a gesture? And that could help them get their meaning across, and it could help you to understand better what they're saying. Um, Technology. Many clients with motor speech disorders will have an alternative form of communicating. Once again, you're going to want to learn how to use and program their device so that you can communicate with them. Um, and sometimes you may just need to move on. Um, if you just aren't able to get what your client's trying to tell you and you've tried pretty much everything you can think of, you may just need to say, especially if frustration levels are getting high, you may just need to say, I'm really sorry, I don't understand. Maybe we can move on to something else and we'll come back and try this again later when we're both fresher, when we both had a little break, when we both had a little more time to think about it. You want to let them know that what they're trying to say is important to you and that you want to come back to it, but that it just might be time to take a little break. Um, and you don't want to let that happen too much, but sometimes I think sometimes you'll both have to be okay with that. And that is the end of this week's discussion.